Is it a must to remove all wisdom teeth as soon as they erupt in every single case? And the answer is, I'm Dr. Mo and I'm a doctor of dental surgery. Make sure you stick around till the end of this video because I'm going to say things that are very critical around the decision to remove or to not remove the wisdom tooth. Now, just to provide some context, wisdom teeth are the last molars to erupt, and typically we have 4 of them. They erupt around the age of 17 to 25. Now, unfortunately, very traditional thinking of dentists or even some surgeons is as soon as a wisdom tooth erupts, it's a must to remove it. That is very old way of thinking. Modern dentistry says that the wisdom tooth must be removed if it is necessary. Meaning, if a wisdom tooth erupts and it erupts in the right direction, because usually it can be angulated either horizontally wrong or vertically wrong, and it can even be erupted completely inverted. So for the lower, instead of going this way, it can erupt literally downward. So it's just going the very wrong direction. Also, very common problem with wisdom teeth is pericoronitis, right? And that is the inflammation of the gums that's normally covering either partially or completely the wisdom tooth. Now, for the wisdom teeth, it is not necessary to remove all of them unless if there is a problem with the wisdom tooth. And the problems include, but they're not limited to, pericoronitis, which is the inflammation of that gum layer above the wisdom tooth. Also, if there is a very deep carious lesion, if there is pain from the wisdom tooth itself, if it erupted, came in the very wrong direction, as we discussed earlier, and the list goes on. But why is this? Why is this right now a topic of controversy? Well, because there's a lot of risks that are associated with the removal of the wisdom teeth, and these include, but they're not limited to, possible nerve damage, the fracture of the wisdom tooth itself during removal, or the fracture of the bone that is supporting and surrounding that wisdom tooth, the dislodgement of the wisdom tooth itself into other areas of the face, such as the maxillary sinus, which is right here and right here, or in the lower into, there's a nerve that supplies the lower teeth that's called inferior alveolar nerve, and that is encompassed by a canal that's called inferior alveolar canal. The lower wisdom tooth, if it's pushed in the wrong way, it can get dislodged into that inferior alveolar nerve canal, or that inferior alveolar nerve can get damaged during the process of extraction, or by if the piece of the root get dislodged into that canal, etc. And by the way, that damage can cause complete loss of sensation for this side, or it can cause a permanent tingling sensation. So it can cause permanent or temporary consequences. The removal of wisdom teeth can actually be risky, and the decision to remove a wisdom tooth has to be taken with extreme precaution. It's not just, okay, there's a wisdom tooth, let's completely remove it. So I hope you enjoyed the video. Make sure to like and subscribe. This is a very rapidly growing channel, and I'm loving putting out this content and sharing knowledge about oral healthcare to the general audience. Peace.